How effective are the cortisone injections?
I think cortisone has a role to play in the treatment of arthritis. When everything else fails, and then we can inject cortisone inside the joint. It's a very powerful anti-inflammatory medication, and it should be injected very accurately and precisely. I usually do it under ultrasound control, and then after I've done that, I will splint the finger or the hand or the thumb for about 7 to 10 days to rest the joint, and that is usually very efficient in helping alleviate the symptoms. Unfortunately, this relief usually is temporary, and the symptoms will actually come back after a number of months. So sometimes we can repeat that, and sometimes we can't, and that will determine the next stage or the next step in the treatment or the management plan.
So what would be the other treatment options available?
Well, when the joint is damaged and nothing else works, the cortisone doesn't work, the anti-inflammatory medication doesn't work, the splinting doesn't work, or it's just not enough, then you really have to treat the joint. You can't really get the cartilage to heal. So basically, you can either replace the joint, or you can fuse the joint. Fuse the joint means the two bones that are forming the joint will become one bone. That takes care of the pain, but you lose the motion. A joint replacement will preserve the motion, so that's a very interesting approach. It works really well for the base of the thumb when the disease is not too advanced. It'll give you a much quicker recovery than traditional surgery where the joint is actually fused or just taken out. So, depending on what you're treating, there are different options. I think I would definitely usually favor a joint replacement or a fusion, but that's not always possible. So again, it's important to seek out a hand surgeon to see what stage you are and how you use your hand, because that will also determine how you can get treated. Not everybody should be treated the same way, because I believe that treatment should be really tailored to who you are, how far you are, how advanced you are, and how you use your hand.